Okay, let's dive into this. Welcome to The Explainer. Today, we're unpacking a truly pervasive issue in modern mental health care, and we're doing it by looking closely at the doctoral defense of Dr. Ilenia Martinez. Her research is a profound, incredibly professional look at the chronic underdiagnosis and misdiagnosis of ADHD in women. She really uncovers the societal, the psychological, and the medical barriers that keep women's neurodevelopmental struggles literally hidden in plain sight. It's a fascinating deep dive into a major systemic oversight, and I'm really excited to explore exactly what her research found. Now, I want to hook your attention right away with a staggering statistic from the literature reviewed in her study: between 75 and 90%. That's the estimated percentage of girls affected by ADHD who are completely missed in clinical settings. Just think about the magnitude of that number for a second. We're not talking about a tiny margin of error here. We're talking about the vast majority of an entire demographic slipping completely under the radar of the medical community. So why is that happening?
Well, that question right there is the core mystery driving Dr. Martinez's research. And to solve it, she didn't just look at broad, impersonal survey data. She conducted a qualitative, descriptive, phenomenological study. Basically, she sat down and did deep, in-depth interviews with 12 adult women who either self-identified with ADHD or got their diagnosis way late, after age 18. She listened to their actual lived experiences to figure out exactly why the healthcare system, their families, and honestly, even the women themselves missed the signs for decades.
So here's our roadmap for today. We'll start with the underdiagnosis crisis, then move on to the barriers to accurate recognition, diagnostic overshadowing, healthcare provider biases, and finally, how we can improve clinical evaluation.
Section 1. The underdiagnosis crisis, looking specifically at the costs and consequences.
Look, missing ADHD in women isn't just some minor clinical footnote. It has massive, compounding consequences. The costs of leaving this unidentified are absolutely staggering. Dr. Martinez's research points out that undiagnosed women face severe educational difficulties, including way higher dropout rates. And then, when they hit the workforce, they carry a 30% higher risk of unemployment compared to neurotypical women, not to mention chronic underperformance and workplace instability. On a personal level, we see increased risks for mental health struggles and even intimate partner victimization. And if we look at the macro level, adult ADHD contributes to an estimated annual societal cost in the U.S. of between $105 and $194 billion. Yeah, billion with a B. And that's driven heavily by lost productivity and fragmented healthcare costs. To understand how this happens, Dr. Martinez grounded her study in a theoretical framework called the Gender Role Strain Paradigm, or GRSP. Developed by Joseph Pleck, this theory basically suggests that society creates incredibly rigid expectations for how women should act, right? Women are socially expected to be organized, emotionally composed, and self-sacrificing. So when a woman with ADHD naturally struggles to meet those socially constructed ideals because of neurodevelopmental differences, it creates profound psychological strain and distress. So the crucial point is that this gender role strain leads directly to a behavior we call masking. Because society expects women to be so orderly and attentive, women with ADHD spend an immense amount of conscious and unconscious energy suppressing their natural behaviors. They hide their executive functioning struggles, they internalize their restlessness, and they try desperately to just appear neurotypical. They are masking their ADHD just to survive socially. And you know what that does? It makes it nearly impossible for educators and clinicians to spot the classic external signs of the disorder.
Moving on to Section 2, Barriers to Accurate Recognition. Focusing on the lived experience.
When we shift from the theory to the actual lived experiences of the 12 women in the study, we see exactly what stood in their way. The study revealed 4 primary systemic and cultural barriers. First, a lifelong misunderstanding. 8 out of the 12 women reported that their cultures, their families, and even they themselves fundamentally misunderstood their struggles, often brushing them off as just personality flaws rather than actual neurological symptoms. Second, there was systemic dismissal by healthcare providers who simply didn't listen. Third, intersectional barriers, things like financial costs, insurance limitations, and those endlessly long wait lists that kept them from specialists. And fourth, just a massive overall lack of awareness about how ADHD actually presents in adult females. To really ground this academic data in human reality, listen to this quote from participant P02 in the study. She said, "I never thought ADHD was real for adults, especially women." And honestly, at least half the women in the study echoed that exact sentiment. They had internalized this cultural narrative that ADHD is exclusively a hyperactive childhood condition. That profound lack of awareness prevented these women from even seeking screening in the first place,
leaving them to suffer decades of misattribution and shame.
Let's look at Section 3, Diagnostic Overshadowing by Comorbidities.
Now, what's really interesting about this slide is how it shows the intensely tangled clinical picture women face when they finally do seek help. They carry a heavy comorbid burden. Drawing on data from Sahlberg and colleagues, we can see that 26.3% of women with ADHD have anxiety disorders, compared to just 6.7% of neurotypical women. For major depressive disorder, it's 28.8% versus 7.6%. And Dr. Martinez's study reflected this completely. 11 out of her 12 participants reported having comorbid anxiety, depression, or both.
Because these mood disorders are so prevalent, they create something called diagnostic overshadowing. Basically, this is when a doctor sees the anxiety or the depression and just stops looking for the root cause. They attribute all of the patient's struggles to the mood disorder. The big problem here is that treating only the secondary anxiety or depression leaves the primary executive functioning and attentional deficits completely unaddressed. It just results in years of fragmented trial and error care that never quite works.
And honestly, it's pretty easy to see why clinicians get confused. Primary ADHD symptoms like inattention, time blindness, and executive dysfunction heavily overlap with comorbid symptoms like anxiety, sleep issues, and emotional dysregulation. When a woman presents with exhaustion, restlessness, and emotional distress, doctors frequently misread that complex picture. They see the sheer distress of masking and misdiagnose it as generalized anxiety. They completely miss the neurodevelopmental root hiding right underneath.
That brings us to Section 4, Healthcare Provider Biases and the Impact of Gendered Expectations. So why are healthcare providers misreading these signs so consistently? Well, Dr. Martinez's research points out that the foundational tools clinicians use are inherently biased. Historically, traditional ADHD diagnostic criteria and assessment tools were normed almost exclusively on male samples. They're explicitly designed to detect the externalizing, hyperactive, disruptive, fidgety boy phenotype. They simply aren't sensitive to the internalized, inattentive symptoms that women typically present with. Essentially, the medical system is using a filter designed to let women slip right through.
Because women's symptoms don't perfectly match that male-normed checklist, their genuine neurodevelopmental struggles are often just dismissed. Several participants in the study recalled explicitly telling providers about their struggles, only to be told they were just stressed, and the medical advice they received, try yoga or mindfulness. No way, right? But it's true. This jarring anecdote perfectly encapsulates the systemic dismissal women face, where gender's assumptions about female emotions completely override objective clinical assessment.
Let's move to and see how this builds into Section 5, Improving Clinical Evaluation Processes.
The great thing is, Dr. Martinez didn't just highlight the problem. Her research actually synthesized the participants' insights into a framework for real, actionable clinical solutions. She outlines a concrete 3-pillar action plan. Pillar 1 calls for integrating culturally responsive assessment tools that actually account for intersectionality. Pillar 2 pushes clinicians to move beyond those standard symptom checklists to actively capture masking behaviors. And Pillar 3 emphasizes providing therapeutic validation, recognizing that building a person-centered alliance is absolutely critical for women who have spent a lifetime feeling misunderstood.
The women in the study actively asked for structural reforms, which break down into 3 clear steps. And this brilliantly illustrates the shift we need. Step 1 is adopting narrative-driven assessments, meaning doctors really need to stop relying solely on rigid 10-question checklists and actually make space for patients' life stories. Step 2 is training providers to actively recognizing masking and internalized distress as symptoms of ADHD, not just anxiety. And Step 3 is ensuring care is culturally competent and person-centered, creating an affirming environment where women finally feel safe to unmask. As we wrap up this explainer on Dr. Martinez's vital research, I want to leave you with this provocative thought. The science shows us that the tools, the training, and the societal narratives are all skewed. We know exactly why 75 to 90% of girls and women are being missed. The question now is, how can we actively dismantle the gendered expectations in mental health that keep so many women suffering in silence? It's a challenge to the clinical community and, frankly, to all of us to start seeing what has been masked for far too long. Thanks for joining me on this deep dive, and keep questioning what you see.